Very much, and welcome to everyone to the course One World, One Health, and One Medicine. This is a course as part of the 40th anniversary celebrations at St. George's University. When we think of St. George's University, currently we have more than 15,000 alumni, more than 6,000 students, sourced from more than 140 countries that come to Grenada, that engage us and project back into the world. That is one world. When we think of our education, engaging the health of humans, animals, and the environment, that is one health. And the medicine that we teach, research, and practice brings together the human medicine and the veterinary medicine. So at St. George's University, we're very privileged to not only present to you the course, but also to share our life experiences as it relates to one world, one health, and one medicine. And where better to start than the very beginning? Our Chancellor and founder of St. George's University. Well, first of all, happy anniversary to you.
Thank you. Yeah.
And welcome to our course.
Thank you.
In the beginning, my first question, I guess, if you can engage us as it relates to your conceptual understanding of St. George's University. Why medicine and why Grenada?
Well, the United States, where I come from, for many years now, since World War II, has relied on foreign medical graduates for the medical workforce. Currently today, in a country that you would think would be exporting physicians and medical knowledge and science, we have imported so many physicians that 25% of all doctors in practice in the U.S. are foreign grads, and most of them are foreign born. So we've taken them from their own country. Some of them are the highest board scorers of every country in the world, and they apply for citizenship, and they're allowed to get preferential treatment with visas, and they do residencies in the United States, and many stay in the United States, and that's why we have a quarter of our workforce from foreign countries. So my idea was to take some of the 20 to 25,000 U.S. citizens who are unable to gain admissions to U.S. schools and train them abroad to come back to their own country, to lighten the load for the other countries, increase opportunities for U.S. citizens, and kind of level the playing field against the wishes of organized medicine, who really like the idea of having more foreigners coming into the system and driving that system for about 4 or 5 decades.
Yeah. And 40 years from that inception, St. George's University now is the largest provider of physicians to the U.S.
Yeah, in the past 6 years, we are the largest provider of new residents in the residency system, but you have to do a residency in the United States to get licensed there. So I guess you can say that since we're providing the most residents of any single school in the world to the U.S. system, we clearly are the largest provider for at least the last 6 years of our existence. And in fact, 1%, over 1% of all the doctors in the U.S. now have been trained in the United States, at St. George's for the U.S. market right now.
40 years ago, 1976 to be exact, why Grenada?
Well, Grenada was the only country that responded to my study of establishing a non-U.S. school outside of the borders, allowing U.S. citizens to be educated primarily there and then coming back to do clerkships in the United States and Great Britain. And it was a very unique idea at the time, controversial, and some people said crazy, frankly. But when it works, I guess it's no longer so crazy. But 40 years later, we have proven the concept works, and we're proud of it. Yeah.
And the early days, as you developed medicine as a training discipline, what was the initial thought process that allowed you to think about veterinary medicine, think about arts and sciences?
Well, vet medicine came in almost as a natural, because entry into the U.S. vet system is also very difficult statistically. Right now in the United States, as well as Canada and now even Grenada, where we have an accredited vet school, the majority of the applicants and students are women. And they have a very great high degree of caring for animals, willing to work in a profession that's somewhat underpaid.
Yeah.
And they have, for many years, gone to foreign schools to achieve that in England as well as Ireland, as well as St. George University.
So when you think about the whole aspect of marrying the education of human medicine and veterinary medicine, is there another model that you would have at least appreciated or examined prior to establishing that at St. George's University?
No, well, another United States school would have been nice, but at the time, the requirements for research were so high that by establishing this school in the United States, with the tuition right now to break even would have been about $100,000 per year per student because of the research requirements. So we cut down the amount of research. We specialized in education, of all things, and focused on that. We certainly have a lot of research, but nothing near the level of U.S. schools that have it supported by the federal government.
Of course. And when we think about universities around the world, whether it's looking at medical schools or veterinary schools, it's difficult to identify any site that hosts a human medical site, a veterinary medical site, arts and sciences site, public health site, all in the same campus.
Yes.
So what we have is sympatrically located programs and disciplines that are very much focused on this One Health, One Medicine theme.
Yeah, and they really ought to be, because if you think of the Master of Public Health program we have here that you are more familiar with than anyone, having helped get it accredited and what have you, I'm very proud of that program. But when you think about it, the MPH program helps leaders in the political sense carry out and understand the function of government in terms of making society healthier. And at the same time, when that fails, it goes to the physicians and the veterinarians to figure out what to do about it, to treat these things. So in many ways, it's the failure of political people to listen to people in public health and take off the table the kinds of diseases and accidents that could be prevented that MPH programs all over the world are emphasizing, highlighting, and noting, and the politicians don't seem to either care or listen, and then it falls in the hands of the doctors. I mean, a good example of that right now that I've been talking about a lot in the United States has been texting while driving. Now, I'm hoping that St. George's soon does a formal study about that here in Grenada, and my own wish would be that Grenada, from the MPH program, the political people down here get some kind of report and pushing from the MPH people to eliminate accidents derived from a new phenomenon. For the younger generation, it's not so new, but for my generation, it's brand new. 20 years ago, it didn't exist. And if we could eliminate texting while driving, look at all the accidents and deaths that we would the death rate would go down dramatically, obviously, and we really have eliminated the possibilities by eliminating the pathway to communication between MPH people and government people to enact laws and really home in on the fact that by not dealing with it, you're dealing with it anyway, with people that have died or people that are severely injured. It's happening. It's worse than drunk driving in the United States. It's acknowledged.
Taking selfies as well.
Yeah, and the selfies. Yeah. And that makes the network news, but the political people don't want to do much about it. And yet you could legislate on this kind of thing and say to the cell phone companies, if your cell phone is in a moving environment and you can't turn that feature off, it won't text. And people might say, well, how am I going to live without texting? Well, I lived without it for most of my life, and it worked just fine. You can still use the phone, but the elimination of these things, I think it won't be long before all governments in the world realize texting is that dangerous. This is nonsense. This is silly. Let's go ahead and listen to the people in public health, and try to eliminate this kind of thing. So that's just one example where politicians should be listening to people in public health and saying, you can prevent things. You don't have to always rely on doctors to fix that thing. You can eliminate it to begin with.
And you brought up an interesting point, because over the period of the life of St. George's University, the world would have changed. You mentioned the communication, the medium by which we communicate. And throughout that time, we would have seen the world getting smaller in terms of interactions of people of diverse backgrounds, of diverse geographical locations. Diseases that were once confined to geographical boundaries are no longer. An outbreak in one part of the world is a global issue as well. At the same time, we also appreciate, while the world is contracting, the relationship between humans and animals are also getting closer. Before, pets were isolated to the community, then to the backyard, then to the home, then to the bedrooms, then to the cemeteries. So St. George's University as an institution has also evolved with the changing dynamics of the human realities in terms of this world. Comment to me from your experiences on the human and animal interactions. How do you see not only the public interacting from the human and veterinary perspective, but also your students here on campus, the medical students and the veterinary students? What are some of your experiences with this particular group of students?
Well, it's interesting because both groups are studying to cure illness. It depends on the human beings or animals in the animal world. The vet students always like to brag that the human med students have one species to deal with, and they have the other 10,000 to deal with. So, and I recognize that and understand that they both have the same incentive, though, and that is to be caring either for human beings or animals. And in some ways, and certainly in the agricultural industry, we don't think of vet medicine or human medicine, but yet animals can help spread disease on farms. And from those farms, that disease can come to human consumption. As we know, animals themselves can spread disease into human consumption. So we've had things like the bird flu and all that sort of thing. And so the interaction is there, whether we recognize it or not. So if we don't acknowledge it and work with it, work through it, then we'll read about it every once in a while with the swine flu, this flu, and that sort of thing, and understand that it is very much involved with all sorts of our society and all parts of the society.
So over 40 years, you would have certainly traveled multiple times to Grenada in any given year. And I would appreciate that you would have observed at least some of the different population dynamics in the various aircrafts. The aircrafts move from primarily human passengers to now animal passengers that are joining as well. Sometimes the number of animals can also compete with the number of people that are in an aircraft. How do you, from a positive and a negative perspective, see the movements of animals from a global perspective as well?
Well, I think most governments have been very restrictive on the movement of animals, even pets. In many countries still, you have to get prior passes and considerations to bring even a pet into on a vacation into a foreign country. A lot of that had to do with rabies and diseases like that. And typically, at this point in time, governments want to make their nation more accessible to tourism, obviously. So they have that pressure. On the other side of it, they have the pressures of the old stigmas about dogs and rabies and things like that. So they don't even want to take the first steps for animals. But meanwhile, we're really importing animals all the time for the food chain and what have you. And we really, live as well as animals that are being processed for food. So we really have to recognize that it is changing and let the professionals help guide the political people towards enacting laws and regulations and allow for the free flow.
Exactly. And because we have you here with us for a live seminar, we want to ensure that we maximize the ability to share in your experiences over the decades of the 40 years at St. George's University. So let's sort of think about the 1970s, the development of the concept and the establishment of the school. In fact, tomorrow, on January 17th, you will be celebrating the entrance of your first class.
First class, January 17th.
In terms of the overall global perspective about medical education, you mentioned, for example, the US perspective as it relates to even matching the need for physicians and seeing St. George's University as an avenue to do so. Beyond the North American context, what about, let's say, other regions of the world? How were they attending to their medical issues in the 1970s?
In the 70s, the world really worried about their own countries more than ever before. Looked towards the UK and the US primarily for advances in medicine. The US had a very wonderful reputation for that, with the amount of research that was being done, the fact that the medical schools encouraged people from abroad to enter the US in a research environment as well as in a practice environment. At the same time, some of the traditional European schools were educating many Americans in their own countries. So you have that conflict of who seems to be ahead.
Yeah.
And it depends how you identify the population you're trying to teach. And in the United States, we basically relied on the amount of research and the dollars put into it. And in other countries, they worried about physician production, the numbers involved. I think what's happened is it's kind of melted all together in that the world recognizes that medicine is medicine, no matter what political persuasion you're in, or country, or what have you. Disease is disease. It's worldwide. It spreads quickly as a jet can take off and land now. And we're all in it to have to fight disease and worry about each other with all the different systems in the world of educating physicians, practicing medicine, dealing with all sorts of really problems associated with some societies and the way they practice medicine, including the U.S., by the way. The U.S. is by no means always the leader. If you look at the number of pain medicines and the atrocities really in the United States right now with the overprescribing of pain medicines, that's not a leader, but that is a country that is, I believe, going in the wrong direction.
And the debate on the access to health care as well.
Yeah. So it's increasing need. It's decreasing the patient's ability to survive on their own and prosper on their own, and the reliance is probably greater in the U.S. than in many countries in the world right now.
So in the 1970s, that perception out there of a foreign medical school training primarily Americans and returning to the U.S. Think about that perception, and over the years, as you engage leaders in medicine in North America, has that perception changed over time? And if so, how has that changed in terms of your engagement with your colleagues at other medical schools and the fraternity of medicine in the U.S.?
It has changed. In fact, our new president was the founding dean of one of the newest medical schools in California. Now he's our president. And I think that the way it's changed is that our interaction with U.S. medical schools was very competitive to begin with. And they had doubts. Because we took larger classes, we're educating them in a foreign country and then bringing them back to the States for the second 2 years. So they had legitimate concerns. But when we started taking the boards, the national boards, that's given to all the medical students, we excelled. Out of all the non-U.S. schools, certainly we're always in the top 5 or 10 internationally, sometimes 1 or 2 in some years. And when you have board scores and pass rates that high, people have to take you seriously. So once we went over that threshold, as reluctant as many U.S. deans were, they acknowledged that we must be doing what we set out to do. And they also acknowledged that the body of applicants, the pool of applicants, must be very strong. Because when they stopped having the ability to take more students, the 20,000 to 25,000 per year that were left over were by no means people that shouldn't become physicians. It was not a failure of those students. It was a failure of the medical schools to have room for them.
So the genesis of St. George's University was to focus on building the medical practitioner workforce for the U.S. But then as we discuss the internationalism of St. George's University, we know how students from all regions around the world. At what point in time at St. George's University did you then consider expanding the realm of St. George's University to the international community?
It was in the first decade, really, when we started. When our board scores came in the first few classes, we expected them to have honorable pass rates compared to other schools, certainly above the world average. And the first time out, we had the second highest pass rate in the world on the boards of any single school. So from that point on, that was only 4 or 5 years in, we decided to go after students from other countries as well, to make Grenada a special place where international medical education could take place for people to go back to their own countries. Mixed with a few Grenadians that are on scholarships here and have been for 40 years now. We've had that program. And we think that it's done a wonderful thing in that it's a kind of a mini United Nations of medical education. And you see people from every country in the world. I think there's 140 countries we've had here now. And with different religions and different races. And they come here and they find that they're studying with each other, no matter what religion or race they are. When they're in a team, we usually have teams of 8, small group learning. Whoever's in that group of 8, you're going to be with for that first or second year. You get to know them, work with them, believe in them, trust them, help educate them. They help educate you. And the best way, I think, for people in this world to come together is to come together. And they do it in a place like Grenada, a very peaceful nation, a small nation, but a loving and caring nation where the people of Grenada really care for the students, welcome them. So it couldn't be a better environment for people. I always said to incoming classes that you may come from countries that are right now at war with each other, but when you come here, you need to be at peace with each other and aspiring towards something much higher, and that is curing disease, alleviating pain and suffering, and caring for mankind, your fellow mankind. And what better way to do that than to start with people from these very countries that seem to always want to have hatred and discomfort with each other, and realize that that person from that country wants to do the same thing I want to do. The same exact thing. We're all the same human race. So it's a great equalizer, and it's a special thing for a little tiny place like Grenada to be the nucleus of all this, but it's what makes Grenada a special place to host a medical university.
That's an interesting lesson for the world to learn as well.
A little bit.
Of how to get over some of the differences that we tend to focus on, and recognize that we have similarities, our own general health and well-being. For sure. Grenada, the love affair. A lot of your thoughts thus far in terms of your own experiences at St. George's University has to do with working with Grenada, whether it's the development of the school in Grenada, whether it's providing education opportunities for Grenadians. Tell me about your life experiences with the country and the people that is Grenada.
Well, it's interesting because when we first came, we thought of this as a hosting nation for an international venture that would allow students from mostly the United States and Canada and a few other countries to get a medical degree and go back and practice. So it was a situation where once you were here and you realized there were some Grenadian scholarship students from the beginning, but just a few in number, you recognize more and more that as long as we have the kind of campus that we have, and it's a huge campus now, and has been for a number of years, it was almost something that was hard to live with and not sharing that with the young people of Grenada and from Grenada who may not have the means to come to the university. So the only way to really get them started here in terms of enrollment was to give them scholarship aid. And we did that where just about every Grenadian had either full or partial scholarships to come to the university. And these are opportunities they never would have had otherwise. So instead of looking at this university through the gates, not being part of it, except for having jobs and that kind of thing, they were coming into the gates. And if you come on campus today, you'll see Grenadians along with people from all over the world studying different disciplines, including medicine, getting along together. And the Prime Minister, I was just with him this morning, we're talking about the fact that we have an ever-increasing demand for more medical school seats and more seats in the public health program and other programs here, the undergraduate program. So it's been a real testimonial to the people in the way they've welcomed us, but also now the way they want to have access to education through us.
Somehow, though, in the world in which we live in today, we recognize the strength of diversity and the value that an international experience can bring to students, to the overall education experience, but also in our recent and current global circumstances, we are seeing a separation once again. We're seeing countries breaking apart from unions, Brexit as an example. We're seeing where this whole issue of diversity seems to be now viewed upon as a weakness, seems to be frowned upon. How then will you comment on this growing conversation globally as it relates to challenging the acceptance and the inclusiveness of people and countries from an international context?
Well, when you look at the economic realities of Brexit, that's something I have no knowledge about or comfort level in talking about. But I know it essentially has to do with economics, power, and which country gets more out of a relationship. But in medicine, that's the great equalizer, because we all suffer from illness. We all the countries in the world fighting cancer and all sorts of diseases, common to all of us. So there's no advantage for being out of the system to make your country isolated in order to kind of look down at the other countries for economic reasons when you're suffering with cancer or some other disease at a greater rate than any country in the world. So everyone has to worry about each other when it comes to medical care and medical innovation and medical research. So I think that is an equalizer that takes away the greed part of the whole thing in terms of economics.
So I guess medicine has potential to cure not only diseases, but to cure the socioeconomic and the political divides and symptoms that we also face as well.
It's a good way to put it.
Yeah, interesting. Over the past few years, St. George's University, let's say over the past 6 or 7 years, we have seen a significant increase in our enrollment of students. And by virtue of their graduation and successful entrance into the world itself, we are having an increasingly greater footprint, whether it's from the newest country of the world in South Sudan to some of the larger metropolis regions in the world. The stamp of St. George's University, the logo and the people of St. George's University is becoming more and more well known. So that's 40 years. It took you 40 years to get to this point. Where do you see St. George's University beyond 40 years?
I think it's a continuation of the same, obviously, because we don't want to take away what we've accomplished. But I do feel that we will make inroads to more countries. We have 140 countries now represented in the student body, but there are countries with 1 or 2 students. So I would like to see a greater impact in China, other areas of the world that are looking towards educating some of their students in Western medicine, which is what we have, and allowing for more students to come through the doorways and through Grenada into the U.S. and U.K. rotations. I think that it is a great equalizer in terms of medical education. It will be a great equalizer in terms of cures. And it will also allow us to continue to focus on the ability of Grenada to be a hosting nation for all of this to take place in a small country that really has a need to be the center of it, a country that when you land at the airport, students usually see signs welcoming them as medical students here. So we have a great impact here, and therefore there's a lot of respect for the students from wherever they come from.
Challenges. What do you consider to be the greatest challenge that you've had to endure and overcome, obviously, as a chancellor at St. George's University?
I think the challenges were all very early, and honest skepticism. And after that, when we did so well on the boards, there were some people that still weren't believers yet. They feel they must have just taught for the boards or something like that. There's always an excuse, I guess. But after a few more years of clearly outdoing most schools in the world on the board exams, I think that challenge has really been taken care of. We've managed to eliminate honest skepticism. There are always people that just can't live with it, and no matter what you do or say, won't be happy with what you've done. But just about any reasonable person recognizes that we have established ourselves as a credible university with a special mission. And there are no other challenges other than to see it grow responsibly and to have programs that are needed in the world to be relevant, I've always said a university that doesn't have relevance in terms of what the kinds of graduates it's producing, what they can do in the world, is going to be a university that doesn't exist very long.
And I would imagine, based on those challenges, you would have converted them into opportunities and strengths as well, in terms of using those challenges to further develop the quality assurance and the standing at St. George's University. Tell me, from a quality assurance perspective, what is your view of St. George's University, from my biased perspective, of course, being considered the most accredited, the most approved institution in the world, because we have to serve and we have to ensure that the same way we receive students from 140 countries, the same way we have to ensure that these students, as graduates, are able to be absorbed back into their home countries as well as professionals. What is your value association for the approvals and accreditations that St. George's University now enjoy?
Well, the key ones were from the United States, because people believe, and they showed that the U.S. has high standards. And with the UK, the same thing. So whenever there was a body of accreditation and recognition in the United States, either the federal government, which we have approvals from, as well as various states, we have special approvals because we have our clerkship programs there. I've always said with accreditation and accreditors, there should be three words. The accreditor should say to us, jump, and we should say, how high? And what that means is that accreditors many times come in, they have a site visit team, and they say, well, we like this and this and this, but you need 5 other things. Very few accrediting teams come in, even at Harvard University, and say, everything's fine, we'll see you in 5 minutes, we'll see how it's going. So it's their job to look for innovation, ways to make things better. So when we get those reports, we accept them, but we also view this as a challenge, but as well as a way of proving ourselves time and time again to meeting the challenge early, to making it better, to addressing whatever they have in the ways of concerns, and there are different agencies doing the same thing. So we have to adhere to all of their rules and regulations. And when students go to other countries to practice, where that country needs special references and resources to be noted, we have to do that for each and every country when they ask. Many countries don't, but the key countries do, and we have to be resourceful and make sure we address those things for their students to go back and practice.
I'm always reminded by the saying that no man is an island. And while you have served as a visionary founder and leader for us at St. George's University, I am sure that you would have had a team, friends, and support that allowed us to excel as a center of excellence over 40 years. Share with us your friends. Share with us your support that actually you were able to stand on to allow for this vision to become a reality.
It was early on. About a year after the founding, we were very fortunate to get as our first vice chancellor, Dr. Jeffrey Bourne. And Dr. Bourne was the head of the Yerkes Primate Research Center at Emory University in Atlanta, Georgia. He was a distinguished scientist, and we were a very new school, a year old, and had every reason not to attract somebody like that. But he came down, agreed to become the vice chancellor, taught nutrition, and one of his very close friends was one of the first visiting professors he brought, which was Linus Pauling. And I remember the charter class seeing Linus Pauling in our lecture hall when we were about a year and a half old, saying, who would have believed? So, and over the years, as you know, we've been able to get people from the top universities of the world, Oxford, Harvard, wherever, to come down as visiting professors. We always thought of that as a great win-win situation, because we won academically in that we had their presence here, the students had the benefit of their lectures here and what have you, but we also won because they saw the student body, and our student body is a hungry student body for knowledge and appreciative. So when somebody like Dr. Pauling came down, who was really the first, I'll always remember we had dinner, and he commented, I was wondering what he would think of us. And he said, I've never seen students so energetic, so inquisitive, and such a pleasure to teach, because they were just so thrilled that he was here. And that's continued. They really make visiting professors feel like they're doing something special by coming down here, and that goes both ways. The VPs feel good about the student body and what they've done down here. So that's something that's continued over and over for 40 years now.
I think from my engagement as well with students over my time here, I know that St. George's University is viewed not just as an academic institution, but it's the opportunity for many of us to achieve our dreams. So it's a field of dreams in many regards as well. And as we discuss this, during our anniversary celebrations, you are engaging with not only our current students, faculty, but also our alumni as well. Talk to me about your conversations, about your interactions with alumni across decades leading up to 40 years at St. George's University. What are the different stories? What are some of the impressions returning to Grenada, returning to campus now after whatever period of time they graduated?
Well, the most fun for me personally is the charter class coming back, because they came back, 10% of the charter class came back, and we had about 199 graduates, and I think 11 of them came back, so over 10% came back. And I'm so proud of that, because it's 40 years from the time I started tomorrow. And they're in all specialties. In fact, a number of them have retired. They're coming back. 2 of them have had sons or daughters of this group go through the university, and many more of the charter class, but of that first 10 or 11 that are here now. So when we talk about the stories, it's interesting. They thank Grenada and Grenadians. They thank the administration and myself. And I end up telling them the real truth is you should be thanking yourselves, because you're the ones that brought credibility to the school when you took the national boards. When you saw people like Linus Pauling and visiting professors coming here, you impressed them because you were good students, you worked hard, and you were grateful for the opportunity. And I think it really is that charter class and subsequent classes, but certainly the charter class that stuck it out, that had every reason to think, what am I doing here? Believed in themselves, and they made the university what it is. It was just once that took place, it just got better and better with each class. Each class expected more, which is typical. And the charter class had water shortages, electrical outages, all sorts of infrastructure things that any one of which could have given them an excuse for failure. But instead, they looked at it as an opportunity to overcome those failures of the administration and the government and the services of Grenada, the primary services and infrastructure, and prevail and do well, and study hard and take their boards, and that's what they did. They did it the tough way.
Yeah, because it's always interesting returning to campus, especially some of them would not have even been to our current campus. They would have just been a part of the old Granans.
Yeah, there's not one brick here on this new campus that they saw when they were students, literally. All those buildings have been torn down, and the whole new campus has been built.
So what was the idea behind expanding and adding on to the Granans campus and moving into our current Trublu campus? Was that part of the overall expansion initiative for St. George's?
Yeah, well, the Granans campus was just a dorm facility. Originally, it was an anatomy lab there as well. But we've outgrown it. The government needs it for more tourism. Tourism has been increasing here. It's on one of the most beautiful beaches in the Caribbean. So we're happy to vacate that. We're building another dorm here, a major-sized dorm, and that'll be done in about a year. And so we're happy to leave the Grand Anse campus and let it go back into tourism as soon as we can.
And from Trublu campus, we would have seen affiliate campuses around the world. Our Northumbria University affiliate campus in Newcastle in the United Kingdom. That is another part of the development at St. George's University. Are there any other opportunities that you are thinking of in terms of partnering with campuses around the world as part of the programs offered at St. George's University?
I think there are a number of them, but President Oles, luckily, is in charge of that, and I'm happy to not have to worry about it. But I think the key thing will be demand in terms of students, where there's a country that there's a number of students that would like to come to St. George's, and it pays to have a partnering agreement like that. We would like to do that. There's no sense of reinventing the wheel.
And I know from President Oles as well, his initiative is not only to identify more students, but also to identify strategic students in terms of where they're located and where they intend to return to practice as well. That's also part of attending to the needs from a healthcare workforce perspective to different parts of the world as well. So that'll be very strategic. Post 40 years, what is it for Chancellor Modica? Are you going to, I guess, enjoy the retirement years, or are you going to maintain the same daring and speed going ahead?
I think with the president of the university really doing all the CEO work, I have the opportunity to be thinking about generalized ideas for the university in the future, but certainly all of them pursuing international relationships and being relevant. As I said earlier, I want us to be relevant, and I'm working with the president to make sure that starts to happen to a greater degree. As he said yesterday, we want to double down on what we're already done. We don't need to reinvent the wheel.
So as we begin to conclude our conversation here today, as we would have reflected on those that have gone by, as we would discuss our current students, let's probably think about those that are yet to come, which you may or may not even have the opportunity to engage with, for them to receive the benefit of your mentorship. If we are to, let's say, record this session and share this with students 10, 20, 30, 40 years from now, what is the message that you would like to resonate at St. George's University 40 years from now?
Well, I guess 40 years from now, I guess that's the audience. Wow. I'd like to think that you could come 40 years from now, come to a university that I helped establish, and know that you're coming to a country full of love and goodness, a small nation in size, a large nation in their ability to create a good environment for you to learn in. A fun place to be, by the way, in the Caribbean. But with caring people, and with a country that you'll make a difference in just by being here, and bringing the world together in a peaceful place, as long as you're prepared to leave any prejudices and biases and hatred home. You don't need that here, and you wouldn't want that here. As long as you're willing to accept everyone as a fellow human being, I guess what I did in my beginnings with this university paid off, if that can happen, because this is a peace-loving country that will care for you and make your time here worthwhile if you want to work with your fellow students in taking advantage of this environment. It's a beautiful place.
Thank you, Chancellor Modica. Thank you for your inspiration, your vision, and also the 40 years that you have developed at St. George's University as well. But we are live, and we do have a lot of our community and also an international audience that are joining us for today's seminar. So we would like to open up the opportunity for persons to communicate and to converse with us as well this afternoon. So what we like to do is, if we can just have anyone share their comments, questions.
Yeah, this is John. We've been taking on chat questions while you guys have been gone. And first of all, Dr. Modica, Dr. Daisy, thank you for that. I personally love hearing stories about the school starting out. It seems like everyone else did. So what I'll do is I'll repeat the questions from chat, and we have several. So let's try to spend 2 or 3 minutes on each one. And if someone wants to kind of add to that, just raise your hand, I suppose, is probably the best way, and we'll call on you. But the first question is simple. It comes from Catherine, and Catherine asked, how many countries did Chancellor Modica say are represented by SGU students, faculty, and alumni?
I believe it's 140 total. Currently, I'm not sure if it's 140, but that over the years, it's total 140. Principally the U.S., though, and Canada. That has always been the majority of all of our students.
Okay, all right. And the next question comes from Rebecca, and Rebecca asks, what steps have you taken to make sure that SGU medical education uses the diversity on this campus to train more culturally aware physicians?
Well, that's not the faculty, obviously, but I think as an administrator, one way we did that early on is we made sure that our faculty is based from all over the world. Initially, we had U.S. and U.K. Professors down here, the charter class, because the goal really was to get on the playing board with good board scores, and U.S. students meant everything to us at the time. But over the years, we've managed to take faculty members from all over the world. I don't have the number of countries represented by the faculty, but it's many now. And so I think that's helped us a lot by having faculty members from all over the world, students from all over the world, so that the majority of U.S. students here don't dominate the thought process down here, the teaching and the academic environment. We don't want that to happen. So I guess administratively, that's how we try to address it, by having more diversity in the faculty itself moving ahead. How they do it from their point on, I'm not certain.
But what I always share with students as well is that as a healthcare provider, whether you're a physician or veterinarian or public health practitioner, you do not decide which patient walks into your office, or who presents at the emergency room, or which species of animal attends your clinic, or where a disease decides to outbreak. These are variables that are beyond your control. But as a global health provider, you need to be competent from an international perspective, not only in terms of the science and technology of it, but also in terms of the social and cultural aspects as well. So indeed, having the opportunity to not only study and work here, but for our students, the interactions, living together. You see, if you're living together and you're learning together, you're working together, that's how we believe enable our students to build that level of competency in going forward, both professionally and also personally as well.
Yeah.
Do we have a question?
Yeah, I'm going to run through a few more on the text, and then I will. I'll get some folks to come in via voice. But Felicity asks, what positive impact have been made by the SGU Grenadian medical graduates at the hospital here? And I assume here means Grenada.
Yeah.
Well, the majority of the key impact is the majority of the physicians here are from the university. They're graduates of the university. Currently we take in about 15 Grenadians per year into the student body. So we know many of them will practice abroad and not come home. The government, the Prime Minister, and I always talk about that. That's okay. That was almost planned for. We don't need that many physicians in Grenada. So that, but the workforce here is primarily Grenadian-born and Grenadian-trained through St. George's University.
Excellent. All right, and Julie is next, and Julie asks, with the developing of the online MPH program, inroads will be made in the provision of information to a global audience. Is this a start of the development of a solid base of online courses from the university?
Maybe I can take that one initially. Well, the interesting part about online education that I believe is not a matter of if, but when. As Chancellor Modica would have seen the evolution of medical education over the past 40 years, the online platform is in fact the current and projected platform by which all types of communications occur, including in the educational realm. Having said that, St. George's University have already established itself in the online platform. I know that we do have a team. In fact, the fact that we are engaging you guys currently in our live session, this is part of our online initiative. We have developed free open access online courses. These are massive courses. And we have also enabled programs to develop online, both our Masters in Business Administration, our admissions program into medical school, our Master Public Health program is increasingly offering components of its courses online as well. So in fact, at St. George's University, we have already been developing and will continue to do so because we see value in also enabling students who cannot access education by coming to Grenada, but we can actually reach them via the online system. So we are online and we will continue to develop online within the possibilities that are only limited by our technology and of course our faculty and students as well. But Chancellor Modica, maybe I can add on your contributions to this question in terms of your views and your impressions about online education, especially from St. George's University.
Yeah, it's interesting because it's not my generation that started all this. So But it's here. When I went to college, you had to be there in class every day, and in law school certainly too. So I think that online education is here to stay, obviously, and the universities that adapt to it early will be here to stay also. There's no reason to resist it if it brings more people into university in different ways. At the same time, it shouldn't replace the bricks and mortar campuses that people have worked so hard to build all over the world. Some of the bricks and mortar campuses feel threatened. I've been on other boards of colleges and universities in my life. I still am, actually, and I was the chair of the board of one university in the United States that is a private university, Catholic university, that is in Miami, Florida, Barry University. And universities like that are in the middle echelon in terms of student body numbers, that have to mix it up with the state universities and compete with them, but need a higher tuition to do so because they don't have state subsidies, have engaged more and more in online training to make sure that they're still relevant. And as we talked about earlier, relevance is everything. So St. George's wants to stay relevant, wants to be communicative to all of the students' perspective as well as current, and online education is a way to do that. But we also have to get the courses more accessible, the 101 courses as well as the 501s, and to do that sometimes it involves more technology, more initiative from the administration and resources. But I think we're in a position to help do that in Grenada, hoping that some people will come here at least for part of their education. Certainly the government would like to see that if we can, and we think that our students would like that because having been here once will mean you really were a part of the university.
So the interaction of both brick and click options is probably the best case scenario for us.
That's a good way to phrase it, yeah.
Sure, take it. Thanks, John.
Yeah, and for the next one, let's see if we can unmute the participant and have him or her ask. The next one is Leopoldine, if I'm saying that right. And Leopoldine, I'm going to try to unmute you here and give you a chance to ask your question. You're unmuted. Let me know if... try to say something. Let's see if we can hear you.
Hi, Leopoldine.
We can hear you, Leopoldine, but not very well. Go ahead and state your question, and I'll repeat it if it's not.
Okay. Good evening. Thank you for inviting us for this online anniversary. I am very happy, and I have some questions. One of the questions is that how can you collaborate with other universities in Africa?
A collaboration with other universities. In Africa, yeah.
Where are you calling us from, Leopoldine?
I am calling from Canada, but I have a lot of links with Africa. It is my home country, but I am in Canada now.
We have a program with the University of Juba in South Sudan. We have some students currently enrolled, actually, from South Sudan. It's a small program, but that was an initial collaboration in that country. We've also had a great collaboration from Botswana. Yeah. We've had a number of students trained over the years, over the past, I guess, 10 or 15 years from that country. The government has helped bring those students here. We've trained them. They've gone back. A couple of our graduates were key people in the AIDS project in Botswana. That was a graduate of St. George's early on. So we've done that directly with the government there, not necessarily with the university there, but with the government directly. So we've been trying to partner where we can. Most universities in Africa that we have approached are unfortunately restricted in terms of their own budgets to reach out, to establish relationships, to visit other universities all over the world, so that they don't have the opportunities that we have been able to engage in with a few of the countries where the governments themselves helped to support the relationship. And we've reached out. We've actually had 2 graduations in Botswana, for instance, because we've had so many graduates come from there.
Okay. So, if I understand, it is the university who approach you, or you approach the university.
The African institutions approach St. George's University, or did we?
Yeah, in this case of South Sudan, an intermediary approached us to engage with that university because of really the terrible conditions there medically, and there's been a state of war and revolution there. So an intermediary needed a home for these students. In fact, they came to Grenada with backpacks, and most of our students from throughout the world will come with excessive loads of luggage. They have to pay for books and what have you, and equipment. They come here. In the South Sudan, students came. We met them at the airport. There were 12 of them that came off that flight, that first batch. And when we went to meet them at the airport, we went to help them get their bags. And it really broke our heart to find that they didn't need to go to that room to get their bags, because everything they owned was in the backpack, their carry-on backpack that they had with them when they met us at the airport. So it gives you an idea of the extent that the governments or universities there can or cannot engage with us. So it's been a triumph in many ways, but also a great realization as to the roadblocks that we have in engaging with some of these schools. So we would like to see more. If you are aware of a university in Africa that would like to engage with us in any meaningful way, we would be honored to meet with those people, know about them there, because that's one pathway to success for everyone, to allow those universities to engage with us. We had a meaningful engagement with England through Northumbria University, a British university. We've had that for a number of years now. The program was so successful that after the first few years, the chancellor there invited me there and gave me an honorary degree, and it was a great honor. But it was also a great honor for Grenada, because it meant that our collaboration had done so well that we were a significant part of their operations in the United Kingdom, in England. And we would like to see more relationships all over the world, but especially in places like Africa, where the need is the greatest, and the country and the government here of Grenada is so proud. I just spoke to the Governor General here last night about the South Sudan students and how well some of them have been doing. Not all of them, but many of them have done well. We're so proud of that relationship. It makes Grenada proud to know that they can give back to Africa. A little country like Grenada giving back to Africa through St. George's University. It's an honor, it's a milestone, and it's a reason for our existence to do things like that.
Okay, thank you. I want to conclude, and I tell you that why I ask this question is because University Cheikh Anta Diop from Dakar, Senegal, and the University of Benin, but they are French-speaking countries. But I think that students there might be interested.
Right. Thank you, Leopoldine, very much for that. So we will certainly, as St. George's University, continue to explore all possible partners, and especially those that are most in need, especially in the region of Africa as well. Sure. Are there any other questions, John?
Yes, thank you, Leopoldine. Feel free to reach out to the course staff. Next up is Kareem, and I'll unmute Kareem now. Kareem, are you there? Oh, Kareem was there. It looks like you might have dropped Kareem. If we get to it at the end, I'll ask his question. But Ian Lebovitz is next on the list. Ian, I'm going to go ahead and unmute you. Okay, Ian, if you're there, we should be able to hear you now.
Can you hear me?
We can.
Let me first thank Dr. Modica. It's been probably 38 years since I've seen him. I graduated in 1982. And I'm grateful for the opportunity, and I can only say thank you for the career I've had, which is in many ways due to his efforts and his opportunity. My question, though, is fairly simple and straightforward, which is, when we went to medical school and back then, the goal of most United States students, and I think Canadian students too, was simply to find a place where we could get a good medical training and obtain our medical degree and advance in our careers. We had some international students back then, but they were small in number, mostly from Nigeria. I'm interested in whether he sees the efforts to be relevant as taking different paths for students from the United States and the growing international presence with the school, and how he sees the school managing the sort of divergent goals of the two populations. And thank you.
Thank you, by the way. That's so good to hear from an early graduate. By the very nature of expanding international non-U.S. enrollment, you have to be prepared to cut back percentage-wise the U.S. enrollment, and we are prepared to do that. We, as much as the U.S. has given us in terms of great students with great outcomes and allow the university to thrive and build as much as we have, if we talked about 40 years from now, if we are really to be relevant 40 years from now, in my opinion, you can't rely on the undersupply of physicians in the United States forever. And maybe the U.S. will finally wake up and the medical establishment will educate the number of people that need to be educated to produce the number of physicians. So I think by the strategic planning initiatives that we've had, international enrollment does have to surpass percentage-wise the U.S. enrollment at some point. It doesn't mean we won't be relevant to the U.S. anymore. We still will, I believe, to a lesser degree, but our sustainability and relevance to world medical education will be forever certainly in place as a peaceful nation where medical education can take place. That will, and the need will vary from time to time. I remember after you graduated, not long after that, in fact, the government of Sri Lanka, there was a revolution there. The embassy in Washington called, we met with them, and they had a number of students that had nowhere to study medicine because the school was closed for a couple of years, and we took in a number of students from Sri Lanka. So there are incidents and political circumstances throughout the world where we would be a good place for nations to have medical education at times of political unrest and what have you, and there's nothing wrong with that, as well as a permanent role in places like China and other areas of the world that we really feel that there's a need for model in Western medical education.
If I can ask one more question, would that be okay?
That would be great. An early graduate.
Well, let me start this by saying it's amazing what you've achieved over time. My second question, though, would be, having served overseas in Central America, which is a medically way underserved area, I wonder if there's any ways for our university to reach into those communities to help train physicians directly, especially in countries that are really so sorely lacking in medical support.
Yeah, boy, that's an issue close to my heart, by the way. So I'm proud to know you went to our university and graduated, because these are the things that keep you awake at night. When we had all the problems in Haiti after the hurricane and the earthquake before that, we had a number of graduates going there, serving there, working there. It sounds like you're that type of person, and we were asked to help financially as well with those kinds of things. We did to a small degree. But the resources of countries like the U.S. really needed to be utilized a lot more, and they weren't. So the impact we can make in places like Haiti and certainly Central America are in the areas of permanent scholarships for some people from the country, just like we did from South Sudan. And those scholarships have to be fully funded by us. We recognize that. It won't always be the case like in Botswana, where the government helped. So we are prepared to do that, but we need to identify mechanisms by which to recruit students from countries like that. And with certainly with Central America, the Spanish-speaking environment makes it so that they would have to be proficient in English to be educated at St. George's. So but I admire you, because if you know about those countries, you've obviously done service there, and generally it's a voluntary type service. So you've already contributed, but we'd like to see you must have inroads into possible students that might be coming from places like that. To serve them medically means we'd have to support physicians living there on a permanent basis, and the budgets for that kind of thing has to come from the Gates Foundation or the U.S. government or something. But certainly to help educate students from there is just another seat in the classroom. So by having scholarships there, it doesn't cost us so much. In the hospital setting, we of course pay hospitals to have our students, but that's a small fee indeed when you think about the benefit that would derive from students like that. Hoping that we go back to practice there. That's the other problem we've always had, that you're probably aware of too, that sometimes when you give people opportunities like that, they understandably go to the U.S. or the U.K., and it's hard to leave and go back to their own country, especially after seeing the living standards and the standard of care. But at the same time, they're sorely needed in those countries. So if you can help us invent that wheel a little bit better, I would appreciate that very much, actually. We should...
Thank you. And I'm proud to be from your school, too.
Okay, thank you for that. So next up we have, I'm going to say it wrong, but Nuewe, I believe is the best way that I can say it. Nuewe, I'm going to unmute you, and we can now hear you.
Hello, welcome, Nuewe.
Let's see. Nene, if you join, just let us know, but until then I'll read your question. Nene asked, are there plans for formal collaboration with non-government organizations like the WHO, Save the Children, Doctors Without Borders, for example, for global healthcare efforts?
Yeah, sure. So I can give you some examples from St. George's University. At St. George's University over the past, let's say, 5 or 6 years, we have actually developed a lot of partnerships with non-governmental organizations. And these are what I can speak to specifically. I'm sure that there are partnerships, whether it's with the government of Grenada and different community-based organizations throughout the years as well, and also regionally. But at St. George's University, we host particularly 2 very important international centers. One is the World Health Organization Collaborating Center, as it relates to environmental and occupational health. Now, this center is very strategic. It's located at St. George's University, and it has a mandate for the Caribbean region. The Caribbean region, as small island states, contribute the least to some of the environmental changes across the world, including that of climate change. But invariably, we are disproportionately affected the most. Our coastal regions are eroding. Our land and agricultural use is degrading. Vector-borne diseases is our reality. So the point is that the region needs to be attended to, especially from the perspective of environmental health. And that brings us to the whole aspect of One Health, One Medicine as well, recognizing that health goes beyond treating clinically that of humans, but also working with that of the environment and animals. So that is one example that St. George's University is actually making a significant contribution to in the region. The other opportunity is St. George's University is also a regional collaborating center for the United Nations Framework Convention on Climate Change. Now, this has specific relevance to mitigating strategies as it relates to climate change. So these are 2 non-governmental agencies that we work directly with for Grenada and the Caribbean region as well, especially in the theme of environmental health and that of the challenges associated with climate change.
Okay, thank you. The next we have Vanita, and I'm going to read this one. Oh, okay, Nene is in the chat box, and she says, thank you very much for your answer. So thanks, Nene. I hope we're close on your name here. Next we have Vanita, and she has 2 questions. The first is, after 40 years, does SGU have any plans to open a university hospital in Grenada, as UWI has done in other Caribbean islands, offering specialist care to locals, etc.?
Yeah, we've been working with government for years to do that. As you know, UWI, if you're familiar with, that's the University of the West Indies, that was formed by a number of the nations of the Caribbean to educate students before we existed. So when we came in by offering scholarships to Grenadians, we just made it easier for more Grenadians to receive education. But we don't have the resources of UWI because we don't have the government helping us with our own budget in any way. In fact, we contribute to the Grenada government in many ways directly. So we don't have the luxury of becoming the supporter of a teaching hospital economically. But at the same time, we have tried to contribute over the years. We've given money every year since the beginning of our existence to the Grenada General Hospital, and it's amounted over the years to the tens of millions of U.S. dollars over the years. But in the hospital budget, unfortunately, tens of millions don't go very far, unfortunately. So the real frustration I have is that, no, we don't have plans of building a full-scale teaching hospital here. There is a hospital here in Grenada supported by the government, and we try to have academic programs within the hospital, but we don't have full rotations for any of our students, even the Grenada scholarship students in the general hospital here. They're all sent abroad for years 3 and 4 because we don't have the resources to create this into a full-scale teaching hospital, since we don't have the economic support of the governments of the Caribbean or even the government of Grenada. So that's one of the frustrations we have as a private medical school. At the same time, we know we've increased the health care on the island because we do have specialists coming down. Many of them are graduates, in fact, and they come down regularly. I don't know how many procedures we've done in ophthalmology. We have one of our key graduates in ophthalmology, Dr. Liberti, has seen hundreds, if not thousands, of patients with his group.
Cardiology.
We have cardiology, that group comes down. So we've had a lot of groups. I wish I could name all the graduates involved with them. They contributed over the years, and we've helped build the hospital. We've, in terms of equipment and what have you, but the running of the hospital is a budget that really has to be taken care of by the government. So we don't have that luxury to be able to go ahead and do what we would like and what you might expect, really, even with the question. And it's a legitimate expectation, but the resources run out quickly when you don't have the support of the government here.
And the second question from Benita is, has your initial vision for SGU and its medical school changed with the changing investors? Please comment on, quote, the business of medicine and how quality can potentially be compromised, unquote, in this new age of business.
Well, yeah, the business of medicine is upon us even outside the university, but we've had new investors, and we were grateful to find from Canada, and they've invested essentially pension money from pension funds in Canada in the university, contribute to Grenada and the stability of the government, and the recognition of the university and its quality. But the business of medicine shouldn't be confused with the watering down of the mission of the institutions. We, as an institution, I believe, are better off with investors here, putting money into the university, the physical plant, as well as programs like this, as well as nurturing programs with students from countries like South Sudan who come with the backpacks on their back, and we support them fully to study and live here and what have you. We're doing that more and more. So that's a good news day. And the business of medicine really is to produce enough quality graduates so that people will continue to come here, many, if not most of them, paying tuition to run the university and allow us to do all these other things that we try to do with our budget. And the business really is balancing the needs of those who don't have much and allowing them to receive an education here, whether they're Grenadian scholarship students or scholarship students throughout the world, and balancing their interests with the students who are able to come, pay tuition, and help us with generating the income that we need to balance the budget to do all the wonderful things we do in the world.
Okay, and we're getting close to the end of the questions that are in the chat. The next step is Benita says thank you. The next up is a comment. Looks like it's from Joanna. Joanna, I'll unmute you, and I can hear you now if you like.
Your comment? Is your comment?
Hi,
Yeah,
Joanna.
Joanna, you ready? Joanna, you had a comment. If you want to share it, you may.
Oh, I was just discussing with a nurse, and we can be looking at the program, and we was talking about, is there an opportunity for specialist training for, nurses and other professionals? It relates to, nurses for ICU and so on, because there is a need in Grenada for specialist training. So we just want to find out if there is an opportunity in the future, near future, for such training.
I will let Dr. Satish.
Well, thank you, Joanna, for your question, and welcome to you and your colleagues. I am assuming that you guys are actually viewing us from a hospital setting or clinic somewhere in Grenada, which is nice to have you guys on board with us. Specialist training for, let's focus on nurses. Now, at St. George's University, we have actually, over our history, our most recent history, where we had a school of nursing, and now we have a program that is now reinvigorated to actually deliver nursing education at St. George's University. Now, that is specific to nursing education. The focus of your question is specialty training beyond that. I know, for example, that some nurses would have engaged some of the other type of educational programs at St. George's University. So nurses would have engaged our Master of Public Health program to become specialists in community medicine. Some nurses would have gone to our MBA program, focusing more on administration side of it. Now, the specialty that goes beyond administration or public health that is available in Grenada is very limited in terms of, let's say, oncology nurses or anesthesia nurses. That training does require some type of exposure or experience beyond the borders of Grenada. But there's also opportunities through our partner affiliates where we share graduate education through clinical sites in the US and Canada and the UK and different parts of the world for nursing students to actually possibly engage in those opportunities as well. So I would encourage you and your colleagues to converse with our nursing program here, because they may identify opportunities for you to actually seek experience outside of the borders of Grenada as well, especially in some of those specialty areas that we do not currently offer.
Yeah, I can add to that in a general sense. I think you have the more specificity in the answer, but the truth is, from the way I see it, is that we're trying to increase the level of care in many areas, including nursing with specialty training. But I always like to speak with the truth, and we all ought to recognize, and the truth is that in the Caribbean environment, certainly you have small island nations, and the beautiful part about that is they attract tourists, and that's an important part of the economies here. In a place like Grenada, where the university is so prominent, we're a large percentage of the GDP. We're probably between, depending on who you ask and when you ask, we're between 20 to 35% of the GDP of the entire nation here. It's a good and bad thing. We talk about that with government all the time. I'm proud that we are. At the same time, it makes me worry that the island nations, these small countries, don't have the tax base and the revenues to support healthcare the way they would like to. And one of the reasons, as we see in the United States, there are Obamacare is so challenged and people are frustrated with it. At the same time, we realize there were many people that were uninsured before it. And, the Republicans versus the Democrats, but people get sick no matter what political party you're from. And taking care of them traditionally in the past 20, 30 years in the U.S. has been more and more through emergency rooms, because you can't turn down a patient. So patients who had no insurance will go into the emergency rooms for colds or minor problems, but clogging up the emergency rooms, where people with emergencies had to wait hours to be seen by a physician because the physician didn't know which patient to treat first. There was triage and what have you, but the bottom line is there's long lines because everyone wants access to medical care. And I've always felt, I talked to a lot of U.S. politicians about it, and certainly here in Grenada, it's a burden for a country like Grenada, as well as just about every Caribbean nation that has always had free health care. When we started the school 40 years ago, health care was free. But in the United States, the budget of the economic relevance of healthcare was it was about 3% of the gross national product of the United States in 1977. 40 years later, it's about 18%. So it's a six-fold increase percentage-wise. The reason for that is the success of the medical systems and the healthcare systems. People are living longer. They're more alleviated from pain and suffering because of drugs and treatments and medications. So in many ways, and it's never brought out, in the frustration we all have with the cost of health care, we should be saying, thank God health care costs more, because I might not be paying for it if I wasn't alive. But no one wants to recognize that. And with the Caribbean governments, it's been really catastrophic because they always had free health care 40 years ago, when the level, even in the United States, was only 3% of the national budget. So what's happened is as you could cure more and treat more, of course, everyone in every country wants to avail themselves of that. And when the budget of the government is fixed and healthcare costs is going up almost exponentially, you run out of money and ability to treat. So by not having in place private insurance early on, or health care that was paid directly from the consumer to the physician, in many ways they created an environment where the health care would get out of hand and out of reach for the governments themselves without the tax base increasing. So we're all in this dilemma together, and nurses at the hospital are talking about specialized nurses coming in. The problem with that is they don't have the salaries or the level of salaries to pay for that. So one of the realizations that I have had is a frustration that it really is a system that has done so well that we can't all have access to it. At the same time, I'm proud that we've had so many graduates in the different fields coming back to Grenada to volunteer for a lot of these services. By no means is that a permanent solution. It's a step in the right direction, but the frustration of nursing staffs and hospitals in Grenada and other Caribbean nations is real, and I share in it. And I wish I had a solution for all of these problems. But the cost of health care is something that's gone out of reach for governments that really did not look 40 years ahead to realize that it may go up exponentially, and there was no tax base to support it. So forgive us for living longer. I mean, think about that, the irony of this whole thing.
I know that a lot of Caribbean countries as well are bankrupt because of their expenditure in healthcare as well, and that's an issue that the economists need to work with us all together in the health field to figure out how best to balance the managing the increasing costs, but also with the expected gains, as you mentioned, connected with those costs as well. So, any more questions, comments?
With that, yeah, we've reached the end of the text questions. If there are more questions, you can either chat them now or raise your hand. I'm looking for hands raised, and right now they're all covered, but any further questions from the audience? Now's the time. Okay, I do see a hand raised from Tamara, so Tamara, I will unmute you. Okay, Tamara, we should be able to hear you now.
Welcome, Tamara.
Oh, okay, Tamara does not have a microphone. Go ahead and chat your question, Tamara, and I'll ask it.
As we discuss the cost of healthcare, though, what about the cost of medical education that goes into that? Yeah.
Our tuition for the charter class, because we were just talking about it the other day, they came at $2,250 US a semester, or $4,500 a year, 4,500. Today, I don't even know the exact tuition, but it's got to be tenfold of that. So it's going up a lot. So is the electric bill. We were talking about the lack of electricity with the charter class graduates, and certainly the gentleman that called in that third or fourth class, I'm sure he suffered with lack of electricity on the campus for days in a row sometimes. And they had a study by flashlights, candlelight, literally, 40 years ago, and it was the tough way. But if you look at our electric bill today, I think it's $32,000 US a day. So That's one of the reasons the tuition's
Yeah.
gone up. So we have a lot better infrastructure, and it's easier to live here. But at the same time, it costs more to do that.
Sure. We have a question, John?
Yeah, the question is ready. So the question from Tamara is, what is the proposed role of SGU in providing further preventative health services in Grenada?
Well, the area of preventive services is an area that Grenada and the world is looking at, because as Chancellor Modica just discussed, the cost of healthcare is one that demands for a preventive approach, and that has to do with looking at primary healthcare, that has to do with looking at social health and community health as well. Our president, Dr. Oles, recently spoke about the fact that St. George's University not only contributes directly to the health workforce in the US, but strategically and specifically in the area of primary health care. And primary health care is the level by which individuals have that relationship with their healthcare providers and can identify medical issues early and treat with projective long-term benefits and prognosis as well. So that's one part of it. The other part has to do with recognizing that health goes beyond that of the individual. It has to do with the environment that individual belongs to. It has to do with their social and mental well-being together with their physical. In our programs at St. George's University, whether it's medical education, veterinary education, we are including in the curriculum areas of public health, areas of community medicine, preventive medicine as well. So graduates are being trained in the area of preventive medicine. The question, however, is, are the health systems enabled to allow our graduates to practice preventive medicine? And that is different depending on the health system that you engage, the country or the region that you practice your particular brand of medicine as well. But certainly preventive medicine is part and parcel of the education experience at St. George's University and should also be the practice reality of our healthcare providers around the world. I'm always reminded that an ounce of prevention is cheaper than a pound of cure.
Sure.
Yeah, so preventive medicine is in fact featured, and hopefully one that the world will increasingly migrate towards as well.
And the traditional academic definition of preventive medicine has to do with the areas of expertise that you're aware of. But you know, I go back to it's nice to be the chancellor because you can dream in different ways. You don't have to conform to the rules of different disciplines. But I talked earlier about texting and driving, and I speak to a lot of congressional people and senators in the United States about my own personal feeling about it, and that we really could live without it. But to eliminate it, really, unfortunately, will take a number of experience of politicians directly within their families to see the pain and suffering when a family member or close friend is a victim of an accident with texting and driving. But I believe in my heart that, and I hope, 10 or 15 years from now, somebody will say, this is crazy. This is, if it's known to be worse than alcohol in driving, why are we allowing this? And all it would take is legislation to say to the cell phone companies, that's great, you're making some money here. We lived without it 30 years ago or 20 years ago. We lived without it. So when a cell phone is in a moving environment, whether you're a driver or a passenger in the car, unfortunately, it will be deactivated to text. It will not receive or be allowed to send. If it's that important, pull over or just get on the phone where you can be watching the road. So if we know that, talk about preventive medicine, think about obvious low-hanging fruit areas that I think schools of public health, and I'm hoping our own, gets the students involved, looks at the facts, takes those facts, analyzes them, and the truth shall set you free, and recommends to the government through the university. I'd love to have the Grenada government be the first government in the world to enact stricter regulations on cell phones and not asking the user to restrain, because all the governments in the United States have texting laws. That doesn't work. We get that. We all have to sneak once in a while, myself included. At the same time, if it was eliminated by the cell phone companies, we wouldn't have the distraction. We could still use the handheld phone, put it to our ears, and save some lives. So wouldn't it be nice if the little country of Grenada gets from the School of Public Health a small study with facts that are already out there, recommends to the government to enact legislation that requires cell phone companies, if you want to operate in this country, you must be able to disable texting while a cell phone is in a moving environment. I would love that. I would love to go back to Washington with some of the people I know there and say, you know what, my country, Grenada, has enacted legislation to prevent thousands of deaths. In the US, I forget the number in the U.S. right now, but I think it's in the tens of thousands already that's directly attributed to something. So talk about preventive medicine. That's one area where our School of Public Health can be the #1 school in the world to recommend to a government. Will they bite? I don't know, but I certainly would like to see that ball out in the playing field. I'd like to see legislation for smoking. I'm a close friend of the health commissioner, a former health commissioner of New Jersey, who was so proud that he eliminated all smoking in hospitals, outside of hospitals even, on the grounds of hospitals, in public buildings, had a lot of opposition from the tobacco companies as well as others. He was proud of that. And he's one of our vice presidents now, senior vice president of the institution. I'm proud to know him, and I've often talked to him about the fact that a little nation like Grenada should enact very tough anti-smoking laws and address the primary excuse of smokers to continue smoking. The primary excuse they have is, I grew up smoking, I'm addicted. You cannot take the cigarettes away from me. It's an excuse, it's real, I believe that. Yeah. I would love Grenada to be the first nation to say, okay, we don't want you to start. Let's take an age. Is it 15? Is it 10? Is it 1? Whatever age, you can say no reasonable person could have started smoking by this age, and say if you are this age or younger, if you are found buying or possessing a cigarette, there will be a huge fine. Not a huge fine. You wouldn't want to be caught, and a retailer wouldn't want to be caught selling them to you. And that age should increase 1 year every year. So that person or that generation can't say they were addicted and they had to continue smoking. You might say, well, that's kind of like, that'll take 100 years to play out. Well, if we started it 30 years ago and we said the age was 10, a 40-year-old or under would not have the excuse they smoked, and a 40-year-old and under would have to pay a huge fine if they possess cigarettes. Is that overkill? Maybe it is, but how many people die of smoking? So how many governments or countries have addressed the problem, having it identified by a public health school? So talk about preventive medicine. We talk about it, and we deal with it in an academic environment, a medical environment, but the low-hanging fruit sometimes we don't want to tackle. And I'd love to see our university engage with laws for Grenada to take action on, so we could set an example for the rest of the world to really tackle these things and not give us excuses to continue terrible habits, not just bad habits, but terrible habits that are killing people.
Well, I guess I know where my next research project is coming from.
That's what I was trying to do.
Exactly. So looking forward to engaging all of our colleagues and students as well, as we engage the topic of texting while driving and of course smoking. And these are topics that engage the whole aspect of human behavior. And it does require not only for education, but it requires for a whole change in the attitudes and perceptions as well. So we will be looking certainly at this aspect of health from the social aspect, from the political aspect, from the legal aspect as well, but also from the mental aspect. Any other questions or comments? Okay, so what we'll do now is just wrap up the session, and by doing so, let me first of all just direct you to our link, because this session is the first of a year-long online program where we'll be discussing different topics as it relates to One Health and One Medicine each month throughout the year of our 40th anniversary. And we feel very honored and privileged to have started our course with our founder and our visionary leader as well, Chancellor Modica, as part of our live seminar today. Thank you for joining us. Please remember to enroll in the course, and we look forward to engaging you on another occasion as we celebrate our 40th anniversary here at St. George's University. On behalf of myself, Satish Bidesi, and our team at St. George's University, I would like to mention our online program director, Jonathan Modica, our instructional designer, John Soap, who you guys would have been hearing from during the session, and of course our on-site presence as well, Donna Walker. Thank you very much, and until another time, let's ensure that we do not text while we drive, and we work with everyone. So let's prevent even the basic excuse of exposure to cigarette smoking. On that note, thank you, Chancellor.
Thank you, and it was an honor to be here at this first session, and it's been fun. I've never done one of these before, so for the old guy, it's a great, unique experience looking into the camera, knowing I'm seeing our students out there. It's really great. Thank you.
Thank you. Pleasure. Thank you once again. And thank you very much, guys.
Thanks, Dr. Modica. Thanks, Dr. Bidesi. We have some chats coming in. Thank you coming in on the chats. And everyone's still muted, so you won't be able to hear from them. But thanks to everyone that joined. We'll put this lecture up on the course website, and we will have another one in February. So we look forward to seeing you there.
So, thank you, everyone. Thank you so much. Very much.
My first time.
So many firsts for you to come, you see? Many firsts. Good.
Thank you. I appreciate it. It's fun.
And John would be back as well.
Oh, good.
So he would have enjoyed.